students. The topic we are going to discuss in this session is hypersensitivity reactions, which comes under immunology. So since we know the basics of immunology, this will be telling you how the immune system or immune response will cause damage to the host. Normally, what we believe is immunity and immune response will protect against the foreign antigens, but there are instances where it can be dangerous to our own tissues. So the topics we are going to discuss is what is the definition of hypersensitivity, what are the types, mechanism, and examples. And all these are very important in the point of view of exams, because these were the previously asked questions. What is the definition? Explain in detail type 1 and type 4 hypersensitivity. So we need to know the mechanisms of these hypersensitivity and its examples. So when you say what is hypersensitivity, the name itself shows that hypersensitivity, that means an increased immune response or exaggerated immune response. So when this immune system in its attempt to destroy the pathogens or destroy the foreign invaders, it will cause damage to the host tissue itself. So that leads to some kind of an exaggerated response. That is what is called as hypersensitivity. So it's a condition in which the immune response results in excessive reactions leading to tissue damage, disease, or even death in a sensitized host. And this is very important. Note, sensitized host. That means once a host is sensitized or exposed to an antigen for the first time, when the same antigen comes for a second time in a shocking dose or in an exaggerated dose, the host will show an excessive reaction to that particular antigen. That in turn can lead to damage to the host tissue, leading to tissue damage, disease, or even death of the host. This is what is called as hypersensitivity. So we have four major types of hypersensitivity, 1, 2, 3, and 4, of which 1, 2, and 3, it is antibody mediated. We know immunity is of two types, humoral immunity and cell mediated immunity. Humoral is antibody mediated. So when you see how the first three reactions takes place, it is mediated by the antibodies, whereas the fourth reaction, it is T lymphocyte mediated or cell mediated. So it is only the type 4 hypersensitivity which is cell mediated. All others are antibody mediated. So you call the type 4 hypersensitivity as delayed hypersensitivity reaction. Why? Because after the second exposure to an antigen, this reaction takes place at least after 48 to 72 hours. The others will take place within hours. So this is supposed to be a delayed hypersensitivity reaction. So please don't forget that term. Delayed hypersensitivity is type 4, and that is the only hypersensitivity which is cell mediated. So in a nutshell, this is what you can remember about type 1, 2, 3, and 4. 1, you can see it is because of exposure to an allergen. So 1 is something which deals with allergy, and you know the immunoglobulin which is responsible for allergy is IgE, and it is IgE will bind to the surface of mast cells. So mast cells are involved. So type 1 is IgE mediated. It occurs within 1 hour. So you call it as an immediate type of hypersensitivity reaction. And one example that is an extreme to allergy, when allergic reaction becomes systemic involving different organs, you call it as anaphylaxis. So that is type 1. And what about type 2? Here you can see there is a cell. On the surface of the cell, there are antigens to which one antibody is binding. This in turn will lead to destruction of the cell. So it is a cytotoxic reaction, but it is mediated by antibodies. So IgG or IgM mediated cytotoxic reaction. It occurs in hours to days. An example for this one is hemolytic anemia. And type 3, you can see an antigen-antibody complex formation at the beginning. That's called immune complex. When this immune complex gets deposited in certain organs, it will lead to activation of complements, and neutrophils will be activated, which leads to inflammation. So immune complex mediated reaction is type 3, and the best examples are serum sickness, which we will see later. And type 4 is what I told you, that is the only hypersensitivity which is cell mediated. It is called the delayed type hypersensitivity reaction. It is T cell mediated. It may take days to weeks for the whole reaction to occur, and the contact dermatitis, then tuberculosis, tuberculin skin test, lepromin skin test, everything comes under type 4 hypersensitivity reaction. So coming to type 1, this is a very, very important question. It's repeatedly asked for university exams. So type 1 is otherwise called as anaphylactic reaction. And another term I told you, type 1 is also called, sometimes the question will be like this, immediate hypersensitivity reaction. Delayed type is type 4. Immediate, when you say it, you mean it is type 1. IgE mediated, and there are two forms for type 1 hypersensitivity. One can be a very mild form that is called ectopy. So ectopy, it is actually a non-fatal localized form. It will be confined to a particular region like skin or lungs or whatever. Whereas if it is a potentially fatal systemic illness, you call it as anaphylaxis, which is very dangerous. If you don't treat the patient immediately, you may lose the patient. So we'll see how type 1 hypersensitivity occurs. Initially, we know most of us may be having allergies. So when you are getting exposed to an allergen, it can be some common things like a dust, pollen grains, or any kind of food, or sometimes certain drugs and all. So when you have an initial contact with an allergen is an antigen which can elicit the production of IgE antibodies. So when this allergen is binding to the surface receptor of a B lymphocyte, which is specific for that, this B lymphocyte will present this antigen to T helper cells, which in turn will activate this B lymphocyte to produce IgE. So B lymphocyte is activated to a plasma cell which releases IgE. So when you say type 1 hypersensitivity, never forget it is IgE mediated. And what will this IgE do is, they will go and bind to the surface of mast cells, because mast cells have got receptors for IgE. IgE receptors are present on surface of mast cells. IgE will bind to these receptors. And what happens is, they will be waiting readily for exposure to this antigen for a second time. So during second time, when the same host who is already sensitized get exposed to the same allergen, what happens is, this allergen will go and bind to these IgE molecules on the surface of the mast cells, which will lead to cross-linking and degranulation of the mast cells. So when this allergen binds to this IgE on the surface of the mast cells, what happens is, there will be sudden degranulation of the mast cells. All the granules which are stored inside the mast cells will be released, and these granules will contain the allergic mediators, which are histamines and other mediators which mediate allergy. So those mediators come out into the blood, and that will elicit the allergic reaction, like what we see: itching, rashes, redness, wheezing, all kind of allergic reactions occurs by that. So we have two kind of mediators which are released from the mast cells. One is called primary mediators, which are already formed inside the mast cells, and also it is present in the basophils. So these granules, the common primary mediators are histamine and serotonin. And you have the eosinophil chemotactic factor of anaphylaxis, which will attract the eosinophils to the site, neutrophil chemotactic factor, then proteolytic enzymes. All these are primary mediators. Don't forget histamine and serotonin, which is the most important. We know histamine mediates allergy. That's why we take antihistamines, right? So those are the most important primary mediators. Coming to secondary mediators, it is actually not already produced in mast cells, but they are newly formed on stimulation of the mast cells, on exposure to these kind of antigen and all. So those are the slow reacting substance of anaphylaxis, which is a potent bronchoconstrictor. Prostaglandins and thromboxane, again, that is also bronchoconstrictor. Platelet activating factors. So these are the secondary mediators, the SRSA, prostaglandins and thromboxane. So I would like you to remember prostaglandins and thromboxane, which you can remember, secondary mediators that can elicit bronchoconstriction. So when this anaphylaxis occurs, we know ectopy and anaphylaxis is there. So what happens is, when a sensitized individual comes in contact with a shocking dose of antigen, once they are already sensitized, second time they are getting exposed to a shocking dose of antigen, it occurs within few minutes, few seconds to few minutes. The reaction is so immediate, that's why you call it immediate hypersensitivity. And what happens is, there is sudden release of these kind of mediators, the primary and secondary mediators, from the mast cells, and it is released from the mast cells. And what are the primary mediators? Histamine and serotonin. What are the secondary mediators? Those are the prostaglandins and thromboxane. So what they do is, they will have actions like vasodilatation, bronchoconstriction, smooth muscle contraction. So all these will affect different organs. So the target organs or tissues which are affected in anaphylaxis is called as the target tissues or the shock organs. And the primary principal shock organ in humans is lung. So lung is the most worstly affected organ in case of anaphylaxis. So there will be very high bronchoconstriction that leads to the problems in smooth muscle contraction, vasodilatation. So here you can see what we have seen already, the same mechanism. That is what happens in anaphylaxis when there is a second time exposure to a shocking dose of antigen who is already sensitized. And this occurs very fast, and lung is the most affected organ. So it's a medical emergency anaphylaxis. So they'll be having severe dyspnea because there is bronchoconstriction, lung is affected, severe dyspnea, and there is vasodilatation. So there is hypotension. This leads to a vascular collapse, shock, and death. So this is what happened in anaphylaxis. So how will you treat anaphylaxis when a patient presents to you with features of anaphylaxis? It can be following any kind of food intake, or it can be following an insect bite, or after a certain antibiotic injection and all. So that leads to this anaphylaxis. Then how will you treat? You have to suppress the mediators like histamine. So we give antihistamines. You have to give adrenaline. You have to restore the blood circulation, you have to restore the blood pressure, and you need to give corticosteroids to suppress the intense inflammation that is taking place. So this is the treatment for anaphylaxis. So then what is atopy? Atopy is an exaggerated response. What response? Production of IgE to an otherwise harmless substance in the environment. Like most of us may be exposed to dust and pollen and all, but most of us don't respond, don't elicit any reaction, exaggerated reaction, but some will be having increased response. This is because they produce an exaggerated IgE to otherwise harmless substances. So atopy, always remember, it's not a fatal condition. It's confined to certain regions or organs. And the most important examples of atopy are hay fever and asthma is what we commonly know, and it can be to antigens like pollens, house dust, or certain food, and it induces IgE antibodies. So food allergy, dust allergy, and sometimes drug allergy can also be reason for atopy. So the atopy, the allergen which elicits atopic reaction, you can call it as atopin. It combines with the cell-bound IgE antibodies fixed on the mast cell surfaces and also on the eosinophils, which will lead to degranulation, release of histamine, serotonin, everything, and cause the localized form of this allergic reaction. That is what is called as atopy. So how will you detect type 1 hypersensitivity? You can do skin prick test. That is, you can inject the very minute quantities of these allergens intradermally into the skin and check for the wheal and flare reaction that is taking place. So if that is positive, that particular person is allergic to this particular allergen. So that is how you do we have seen the food allergy test and all what we do. So those are examples for the skin prick test for detection of type 1 hypersensitivity. Suppose it is an atopic condition, how will you treat? Again, you can give corticosteroids, you can give antihistamines. But if it goes to anaphylaxis, you have to immediately resuscitate the patient, give adrenaline and supports, all kind of supports should be given because it's a medical emergency. So that's about type 1 hypersensitivity. Again, mechanism of atopy, it's the same mechanism, it has been shown again. So moving on to type 2 hypersensitivity reaction, that is what I told you, that it's a cytotoxic reaction which is mediated by antibodies. So it is because this is mediated by antibodies that react with antigens present on the surface of a cell, resulting in damage to the cell. Ultimately, there is cell damage. That is why it's called cytotoxic reaction. But how does it occur? It is because of the production of antibodies that bind to antigens on the surface of cells. And which antibodies mediate this type 2 hypersensitivity reaction? It is mostly IgG and sometimes IgM. Examples are autoimmune hemolytic anemias, hemolytic disease of the newborn, then myasthenia gravis. All these are examples for type 2 hypersensitivity. So what happens is, if there is a cell like this, suppose this is RBC, on the surface of RBC there are certain antigens. In a host, if suppose an antibody is formed against this antigen, this antibody is formed against the surface antigens on the RBC. This happens in autoimmune hemolytic condition. Our own RBC, our own body produces antibodies against our own RBC antigens. So when this antigen antibody formation occurs, now the complements get activated. The natural killer cells can activate because it will bind to this Fc portion of the antibody. It will release certain substances that causes cell lysis, or the complements can come and cause cell lysis. So whatever happened because of this, as a consequence to this antigen antibody binding which is taking place on the cell surface, ultimately there is cell lysis or damage to that particular cell. That leads to type 2 hypersensitivity. So the best examples are autoimmune hemolytic anemia, hemolytic disease of newborn, that is because of the Rh incompatibility that takes place. So the same thing has been depicted in this figure. You can see this is the RBC. The antibodies are there. Antibodies bind to the RBCs, which in turn will lead to antibody-dependent cell-mediated cytotoxicity, which can be due to the natural killer cells, which can be due to the complement. However, what the final consequence is the RBC will get lysed. So this is what happened in type 2 hypersensitivity. Coming to type 3, which is called as immune complex reaction, it is due to deposition of free antigen antibody complexes. So here it is not on the cell surface, but you have a free antigen to which antibody is produced, and this antigen antibody complexes are present in the blood. These complexes will get deposited in organs like the vascular endothelium, the glomerular membrane and all, and which will elicit inflammatory reaction. When there is immune complex deposition in the tissues, it will lead to complement activation and attraction of neutrophils and all, which will cause inflammation. So this also finally lead to tissue damage, because of the complement activation and inflammatory cell infiltration. There are two types of type 3 hypersensitivity reaction. One is Arthus reaction and the other one is serum sickness. So, and another example for immune complex disease is your post-streptococcal glomerulonephritis, which we have learned that is in streptococcal infection, certain antibodies are produced against streptococcal antigens, which those complexes can get deposited on the glomerular basement membrane, which can elicit inflammation and destruction of the glomerular membrane, leading to nephritis, glomerulonephritis. That is an example for type 3 reaction. So Arthus reaction is actually a localized form of type 3 reaction, and here the antigen antibody complexes get deposited on the walls of the blood vessels and activate, complement and attract neutrophils, leading to vasculitis. So Arthus reaction is a kind of local vasculitis, whereas serum sickness is actually because of administration of serum which is derived from some other species like equine horse serum, which is administered to humans. For example, in tetanus, we give anti-tetanus serum if it is horse derived. If you inject it in a loading dose, it can lead to production of antibodies which will peak in a week. Maybe the antibody titer will peak in a week, and that can lead to a lot of immune complex formation which get deposited in a multiple tissues, multiple organs. So that will lead to a massive kind of reaction. So this follows a single injection of high concentration of foreign serum. So they get deposited in the endothelial lining of blood vessels in various parts of the body, causing inflammatory infiltration. So that is about type 3. The examples were Arthus reaction and serum sickness. Now coming to type 4. So after type 1, the most important question for exam is type 4. I told you type 4 is delayed or cell-mediated reaction. Here the tissue damage is mediated by T lymphocytes and not by antibodies. So don't forget type 4 is T lymphocyte mediated or cell-mediated hypersensitivity. So here you can see in the sensitization phase, a bacteria which is processed by an antigen presenting cell, it is shown to a T helper cell. The T helper cell gets activated into Th1, and some of the T helper cells will become delayed T helper cells, which will remember the same antigen when it comes for the second time. The DTH cells will be activated very fast in the effector phase, and that will release interferon gamma, TNF beta, which can activate the macrophages into activated macrophages. So these macrophages will be very much active. It will try to destroy the antigen, and in that effort, it can also cause tissue damage because its action will be very much higher than the normal macrophages. So that is what happened in type 4 hypersensitivity. So there is a sensitization phase and there is an effector phase, but it's mediated by the T helper cells. And the final sequelae of this reaction is activation of macrophages, that is what is responsible for the tissue damage. So the antigen activates specifically sensitized T helpers, T lymphocytes, which leads to secretion of cytokines. It is actually the cytokines like interferon gamma and TNF beta, which causes activation of macrophages and tissue damage. So this occurs within 48 to 72 hours of antigen challenge, the delayed, because if it's an already sensitized host, if you give antigen for the second time, after 48 to 72 hours, you will get an erythema and induration. And the most common test which is set as an example for this kind of reaction, it is tuberculin test. And so you call the reaction as tuberculin type. There is another kind of type 4 hypersensitivity, that is contact dermatitis type. So what you do in tuberculin test, it's called Mantoux test or tuberculin test. You inject a small dose of tuberculin antigen intradermally to a sensitized individual. So you're going to test whether the individual is sensitized. Suppose that person is already exposed to a TB infection, or if he's having a latent TB, is having a very mild latent TB, or he's vaccinated with BCG vaccine. In that case, if you inject this tuberculin antigen, 40 to 72 hours later, at the site of injection, they will develop an erythema and induration more than 10 millimeter size. So that you consider as a positive tuberculin test. So when tuberculin test is positive, what it indicates is the person is already exposed to TB bacilli. It can be in the form of infection or it can be in the form of vaccination. Other example is lepromin test, which you do for leprosy. And the other type of type 4 hypersensitivity reaction is contact dermatitis. The best examples are certain metals or soaps, cosmetics, when certain drugs like antibiotic ointments, when you apply it over the skin, it can elicit some type 4 hypersensitivity reaction which is confined to the skin. That is called as contact dermatitis. So most of us will say if you have some kind of reaction, erythema, rash, induration and all in your skin following exposure to certain chemicals or soaps or cosmetics, you say it's contact dermatitis, which is actually type 4 hypersensitivity reaction. Then there is another type called type 5, which is actually an extension of type 2. That's not that important. It is actually, type 2, what happens when there is antigen antibody reaction, an antibody binding to an antigen on the surface of a cell, it causes cell lysis or cell destruction. That is what is type 2, cytotoxic. But instead of causing cell lysis, if it enhances the activity of the affected cell, you call it as a type 5 reaction. This is very rare. The only condition where we commonly say it's a type 5 reaction is Graves' disease, where there is increased production of thyroid hormones as a result of this antibody binding to the thyroid cells. So that is type 5. So once more, all these topics, please remember, all are important. Hypersensitivity is a very frequently asked question. Type 1 and 4 are the most important. 1 is IgE mediated and 4 is cell mediated or T cell mediated. And examples for 1 is anaphylaxis and atopy, and please learn the mechanism. And type 4 examples are contact dermatitis and tuberculin type of reaction. So that's about hypersensitivity reactions. Thank you.